Welcome to the R.S. McLaughlin Durham Regional Cancer Center. The information provided in this video is to help guide you through your radiation treatment. We will be presenting an overview of the process you will go through at our state-of-the-art facility, from your initial planning visit right through to the completion of treatment. Our goal is to provide you and your family with information about your radiation treatment process to help make your experience easier and less stressful. Your first meeting is with the radiation oncologist and primary care nurse. They will review information concerning your present health situation and your treatment options. You will receive one or more of the following items: a Canadian Cancer Society booklet. This general guide provides an overview of radiation therapy. A radiation therapy pamphlet specific to the area or site of your cancer. This pamphlet provides information about any special preparation you may be required to follow prior to treatment, and a written care plan and consent form. This plan, prepared by your radiation oncologist, is specific to you and outlines your treatment options. You must provide your consent for treatment by signing this form. We encourage you to seek further information from our Patient Resource Library. It can be found on the main level of the Cancer Center. Also visit the websites provided by the Canadian Cancer Society, Lakeridge Health, Hearth Place, and Cancer Care Ontario. You should also contact your local office of the Canadian Cancer Society. They can offer other services to you, such as the Volunteer Driver Program. Lodge-type accommodation is available if needed. If you are receiving treatment and live more than 50 kilometers away, you may be eligible. Whenever you come to our cancer center, please enter through the main entrance on Parkwood Court. For radiation planning and treatment appointments, proceed to the B1 level, either by the stairs or elevator. On your first visit, check in at the reception desk. On following visits, please check in at the kiosk. Instructions for its use will be provided by the clerk at reception on your first visit. After you have checked in, please be seated in the reception area and wait until you are called for your appointment. Your first appointment in radiation therapy is usually for treatment planning. Following visits are for treatment delivery. You will meet with your radiation oncologist and/or primary care nurse weekly. Radiation therapy is a very effective treatment for cancer. It is a localized therapy that concentrates on a specific area of the body. It is often used along with surgery and chemotherapy. Radiation therapy treatment is intended to treat tumors by destroying the cancer cells, slowing down, or stopping their growth. Careful planning is done to control the dose to normal cells. External beam is the most common type of radiation therapy. It is given using a large machine called a linear accelerator, which targets the radiation to the affected area. The primary goal of radiation therapy is to give the tumor the highest possible dose of radiation while limiting the damaging effects on normal tissues. Your care team is comprised of many people who are either directly or indirectly involved with your treatment process. Radiation oncologists are doctors who specialize in treating cancer using radiation. Their role is to prescribe your treatment and to lead the radiation therapy team in the development of your treatment plan. You will not see your radiation oncologist at every radiation appointment. You will be scheduled to meet with them in review once a week. A radiation oncologist is always available to see patients and is involved in monitoring your treatment. Radiation therapists provide daily contact and support through your radiation therapy treatments. They are responsible for your treatment planning, treatment delivery, and well-being on a daily basis. Radiation therapists ensure that your needs are met, whether it be treatment-related or dealing with other difficulties as they may occur. They provide advice and appropriate referrals to other healthcare team members. Dosimetrists are responsible for developing a radiation treatment plan that is specific to your needs. They use specialized computer programs working with your unique measurements and information. They work very closely with the radiation oncologist. They carefully determine how the radiation is given. Dosimetrists calculate the exact dose for the tumor while minimizing the dose received by healthy surrounding tissue. At our cancer center, all dosimetrists are radiation therapists, so they understand the special needs of radiation therapy patients. Although you will probably never meet a medical physicist, their role in your radiation treatment delivery is essential. They carefully check each treatment plan. The medical physics department is responsible for ensuring that the treatment units are running at their peak performance. They diligently test the units on an ongoing basis to ensure they are functioning within specified parameters. The primary nurse works closely with the radiation oncologist. They provide information about your treatment and help you with the management of side effects. You will meet your primary nurse at your first consultation appointment. Throughout your radiation treatment and into your follow-up, your primary nurse will always be there for you. You will not see your nurse every day, but he or she will join you at your weekly review with your radiation oncologist. In addition, there is always a nurse available in the radiation therapy department should you need one. Unit clerks work at the reception desk. They are the first people you meet in the radiation therapy department. They are responsible for all radiation bookings and provide assistance should you need it. Volunteers are available to help you check in for appointments. They are a great source of comfort and support during your time in the radiation waiting area and provide you with beverages and light snacks. Other support services are also available as part of your care team. They can be accessed upon your request or at the request of a member of your radiation care team. These valuable professionals include oncology social workers, psychologists, dietitians, oncology pharmacists, dentists, physiotherapists, and your family doctor.